This is placing a male urinary catheter on a cat. I have all my supplies set up right here. And this is the catheter that I'm going to be simulating placing. It's a 3.5 French red rubber catheter. I have my sterile gloves right here. I have chlorhexidine for scrubbing the penis with. I have the sterile lube. I have a syringe for collecting the urine sample. I have a urine collection tube for putting the sample in. And then I have a needle for putting onto the syringe to put into the tube. So she's restraining him in lateral recumbency for me. And so the first thing I can do is take this and measure about how far it's going to go in. So you could do it by feeling where the bladder is, about right here. And then you would wrap this around here following the line of the urethra. And it would come to about right here. So I'm just going to kind of mentally remember that it's going to be about this area here for when I place it. So now I'll go ahead and open my gloves.
Yeah, that's what I was doing like doing a toxo test and maybe repeating x-rays to get.
Okay, and now I could place my sterile syringe on here.
That's what makes me.
And my sterile lube
That's why we were thinking, yeah.
for lubricating the catheter.
I don't know, I mean I haven't gone in, we're still waiting, but I was just couldn't believe the blood work was normal.
And so I'll go ahead and put my gloves on, use an open gloving technique. I'm not touching the syringe or anything. And then after this point, I won't touch anything else that's unsterile. So, she will go ahead and open the catheter for me sterilely. I won't let it touch anything else. And then she'll extrude the penis for me so I can scrub it. And when I'm grabbing the scrub, I'm just going to grab this top one so that it's not touching the one that was on the tray. So I'll grab the top one. And then I'll scrub the area without touching anything else. And then I'll go ahead and lube this. And then this is my simulation part where I would feed it into the penis, and without using excessive force, I would feed it up until where my measurement is, which would be about to right here on the patient. And then once it's successfully placed into the bladder, about to where my measurement was, I can go ahead and take the syringe, attach it to the end of the catheter, and I would withdraw my sample from the patient. After that, I can disconnect from the catheter, and I can begin to pull the catheter out slowly, making sure not to use a bunch of force or anything. Slowly pull it back out, and then I would take my sample, put a needle on the syringe, let the vacuum suck out the sample, and then I would mark it with the patient's name, which is Sonar, and the date. And then this can go immediately into the fridge to be sent out to the lab. Hi, this is Lisa, and this is a continuation discussion of the urinary catheterization videos. I just want to elaborate a little bit on the importance of sterility and being careful when placing the urinary catheters. When you're placing the urinary catheter, you want to be able to not cause any kind of trauma to the patient. So one of the things that's very important is lubricating the catheter before passing it. That way it could glide smoother and you're not creating a rough transition for the catheter inside the urethra. If you don't, it could cause trauma to the urethra or to the bladder wall that can cause more problems for the patient. Another thing is when you're passing the catheter, you want to do so very, very gently and to not force it, because there could be some kind of obstruction. There could be like a narrow passageway. Or whatnot. And you could, if you force it and not go gently, you could create some kind of perforation inside the urethra or the bladder. So that's another good reason why you want to measure the catheter as well before placing it, because if you keep feeding it and feeding it and feeding it, you could perforate the bladder walls as well, so and cause urine to leak out into the abdomen. So that's why it's really very important to be very careful when you are placing the catheter, as far as being gentle, measuring it, and lubricating it properly. The other point to make when you're placing a urinary catheter is to make everything completely sterile. You're going to wear your sterile gloves. You're going to use a sterile catheter. And then after you're all gloved up, you're not going to touch anything that's unsterile. You're not going to reach over for anything, any other equipment. You're not going to brush your hand up against anything. You're not going to put your hair back. You're not going to reach for your phone. You're not going to pick your nose. You're not going to do anything. And then sometimes people do things without thinking of it. Just automatically they'll go to scratch their nose or brush their hair back or brush up against something. You need to be very aware at all times where your sterile field is and where your hands are at all times. So one thing I like to do, especially if I'm in surgery or placing a catheter, is I like to keep my hands like I'm praying right in front of me. So I clasp my two hands together. When you're placing a urinary catheter, you can't really do that, but I do still like to keep my hands up in front of me with the catheter. That way that I'm not brushing up against anything, and there's less chances of me touching something that's unsterile, because if you do touch something that's unsterile, you're introducing potentially pathogenic microorganisms to the patient that wasn't there in the first place, causing even further complications as far as urinary tract infections and whatnot. Because when you're in a veterinary hospital, as much as we clean, it's like 99% of the job is cleaning. It's very unsterile around the patient, as far as, the sink that you could be working on or the exam table that you're working on has had like anal glands, vomiting, diarrhea, fungus, parasites, just all kinds of things that it's exposed to, and we don't want to introduce any of that to the patient. So that's why it's of utmost importance, after you're gloved in and you're all sterile, you don't touch anything sterile, nothing at all. So just be aware of that, and be aware of your sterile field at all times.